ring scotomas, but it's only undertaken once you've got the knowledge of what you're dealing with. Here's another one, slightly different. Again, the scotoma is bordering 3 sides, and therefore this fixation in that area where the blue dot is would function just like the previous one. It functions like a foveal sparing or ring scotoma. Again, this patient has fixation over a fairly broad area. Here's the seeing area. This yellow is the area that the patient sees well, and it's surrounded by very dense scotoma. That's a trick to help a patient visually be competent with that limited area. Another area, this time great fixation, probably pretty close to fovea. But when you look at that fundus image alone, you cannot predict what's going on. This case would really need perimetry to sort this out, certainly to undertake rehabilitation. In fact, what we might find is that this is the seeing area surrounded again by very extensive scotoma. So again, this is the schema of what's going on. These patients basically want to view targets that just don't fit in their viewing area. So that's ring scotomas, particularly in AMD. There's a myth out there that they only occur in geographics, but I think we're really accumulating some evidence that particularly with the newer treatments, we're seeing a lot of ring scotomas now in exudative AMD in addition. I want to leave AMD and go briefly to hemianopsia. Sometimes we forget that patients with hemianopsia also lose central vision, and they too can have trouble with reading. This is a 64-year-old woman who unfortunately had a right hemianopsia. She has excellent acuity, 20/25, very good contrast. She did have Charles Bonnet visual hallucinations. They can occur in patients with good acuity. In this case, her vision loss is her field loss. The top 2 images are the classic Humphrey showing her hemianopsia. And one would think from a lot of our field results that hemianopsias cause a straight line going down. But when we do perimetry and dig a little deeper, what's going on centrally? What's happening in that central 5 degrees? Remember, we read with our central 5 degrees of field. We find out that in fact, this patient is fixing here centrally, the little blue dots, and she has a pretty good horizontal span. So she in fact was doing very well reading, really didn't have much problem. But in contrast to another patient, again, this time it's a left hemianopsia, non-seeing on this side, but we don't have a horizontal span going this way, so this patient would have difficulty with page navigation. So again, hemianopsias are another clinical situation where having information about central field can help. The microperimeter allows us to track retina in real time. We're able to do monitoring of fixation and document it. So we get those little blue dots, they make a big difference. We can then superimpose our perimetry on a retinal image. And for us in vision rehabilitation, it allows us to get that information we need about fixation and use of a PRL and how good that fixation is, how tight the fixation areas are, and then secondly, where is the scotoma and the various configurations of that scotoma. Thanks very much, and I'd be happy to entertain any questions you might have.